Hello everyone, welcome to this channel. Today we are continuing our discussion on homeostasis, but today we will be talking about blood sugar regulation, okay, or you can say blood glucose regulation, okay. So let's discuss blood sugar regulation, okay. So the term blood sugar, like I've said, it simply is talking about glucose. Glucose is good in the body. We use it as our main source of energy, okay? And a lot of food that we take in has got glucose, okay? Now, there's blood, okay? So in the blood here, the level of glucose should be normal. Okay, so sometimes the level of glucose can be low. This is called the hypoglycemia. Sometimes it could be high. Sometimes it could be high. Okay, and this is called the hyper. And this can result into diabetes. Okay, can result into diabetes. So we want the blood sugar here to actually be normal, not high, not low. Okay, we need to be constant at a normal state. Okay, a low blood sugar is a problem, a high blood sugar is a problem as well. Okay, so we want it to be normal. Now, what controls that is a very important organ, which is an organ we talk about sometimes during digestion. This is the pancreas. Okay, now the pancreas here, it makes two important cells, and these cells are made in the islets of Langerhans in the pancreas, and they are made of cells, namely the alpha cells and the beta cells. Okay, so you have the alpha cells, okay, and you have the beta cells. So the alpha cells here, they make what we call glucagon. The beta cells, they make what we call insulin. Very important hormones, right? These are hormones, very, very important. So these hormones work together, okay? These hormones will work together, and they will work together to do what? To control the blood sugar, okay? They will work together to control the blood sugar. So let me just explain. This will be very quick. It's not something to actually cause a lot of trouble. So now, let's say if your blood glucose has become high, the body responds by producing insulin. Insulin commands glucose, to be converted to glycogen. So thereby lowering, so it will go from high to low. This is being done by what? Insulin. So insulin commands glucose to be converted to what? To glycogen. Okay. Then if it's in a low state, here this is where glucagon comes in, and it reverses this process, glycogen to what? To glucose. Okay, so this is how these enzymes work. So if your blood sugar is high, the body produces insulin to convert glucose into glycogen. And again, if your blood sugar is low, the body converts glycogen into glucose. Okay, so now what is this glycogen that I'm talking about? So when there is excess glucose, the body doesn't want this glucose to stay in blood, so it will convert it to glycogen. So glycogen is actually the storage form, the storage form of glucose, and this glycogen is stored in the muscles and also in the liver. Okay, this is where the glycogen is stored. So in a case now when the body needs glucose again, it can reverse it. Okay, so too much glucose, glycogen will be formed. Glucose becomes low, so these enzymes now, that is when they actually come in to perform these functions. Very, very easy step, right? Very easy things to remember. Okay, so I shouldn't complicate these things for you guys. So when the glucose levels are too high, the pancreas will secrete what? Insulin. To do what? To lower the glucose level. And how does insulin lower the glucose level? It converts it to glycogen. Okay, and when the glucose levels are too low, the body secretes glucagon. Glucagon, how does it increase the blood glucose level? It reverses the process. Okay, very, very easy things to know. Okay, so we also going to talk about diabetes. Okay, how it comes in about. So now, just to add on, so diabetes is when a person now has got their glucose levels continuously high over a long period of time. This means that insulin is not working. So there's a problem with insulin. That's why there are people who have this condition and they are on insulin injection. So diabetes, there is type 1, okay, and there's also type 2. So type 1 is where a person completely doesn't have insulin. Okay, this is because these cells can be destroyed due to um, sometimes infection, maybe the pancreas gets damaged, and sometimes autoimmune, where the body's own antibodies attack these beta cells, and the person doesn't have insulin. The person is going to lack insulin. So this is called type 1, and these people, they are put on an injection. Okay, they have to be getting an injection for insulin. Then the other two is type 2 diabetes. This is where the insulin is there, but it is insensitive. Okay, this is called insulin insensitive. The body produces insulin, but the cells are not responding to the insulin. Okay, the cells in the body are not responding to the insulin, and this can come out, this can develop due to your type of lifestyle. Okay, a lifestyle. Okay, it's called diabetes type 2. There are other types of diabetes, maternal diabetes, that I'm not going to discuss in details here, but this is what happens. Okay, what are some of the symptoms of diabetes? Excessive thirst, loss of weight, and also high blood glucose level in the blood. And also glucose can also be found in urine because it's just too high. Okay, I'm not going to go into much details, just to keep the video simple and short. This is how the blood or the body regulates the level of sugar in your body. So the most important things is insulin. I think I've compressed and discussed everything here. Let me know if you've got any question in the comment section. I'll see you in the next video.